My name is Sadio Yusuf, and I'll be doing the three-way case study comparison. And I have chosen three people to do theirs on, Gideon, Jordan, and Lauren, because Gideon talked about nursing homes, Lauren talked about adult daycare, and Jordan talked about hospice care. So a little background on nursing homes. Before nursing homes, there was senior living places called the Almond Houses, built by charitable individuals, an organization for poor people to live in. Um, However, in the 21st century, nursing homes have become a standard form of care for most of the aged and people and disabled people. Um, in 1965, the passage of Medicare and Medicaid provided additional growth of nursing homes industry, uh, which became increasingly studied since the passage of Social Security, growing demand. Between 1960 and 1976, a number of nursing homes grew by 140%. Nursing homes beds increased by 302%, and the revenue received in the industry rose 2,000%. Some strengths of nursing homes: they provide long-term care for patients to get 24 hours care, so that families can also work and not worry about their loved ones. Advantages include and not limited to being part of a community. Patients, depending on the type of care they get, patients are placed in specific location, best location for the care they need and the units they need. For example, a memory care unit for those with Alzheimer's diseases. Some weaknesses: Medicare often only covers a portion of the cost, and if the patient doesn't qualify for Medicaid, then the cost must be covered by private insurance if available. Still, the cost out of pocket is expensive, and most people cannot get it. More frequently, patients die due to lack of care. And then there is a general negative perception of nursing homes. Stigma involved. Most of the families don't like to take their loved ones to nursing homes. Now let's talk about adult daycares. Adult daycare services have been around for about 30 years. The National Adult Daycare Service Association defines as an adult care center its standards and guidelines for adult day services, which was revised in 1997. An adult daycare center is a community-based group program designed to meet the need of an adult with a function impaired through an individual plan of care. Adult daycare emerged in 1970 in response to high popularized and nursing home abuse stories. Due to the negative stigma in a nursing home, adult daycare is a very beneficial resource for elderly because it enables people to interact with patients who would not get these services otherwise. Some of the advantages is it provides healthy meals, safety and secure environment for the day if the person qualifies. There is educational activities, and they still maintain a level of independence with socialization with peers. It's a significant chapter for nursing homes, and more funding is available for those who qualify. Some weaknesses are daycares are only open for several hours at a time, like 7:30 to 5 p.m. Then it becomes difficult and nerve-wracking for loved one to be left at home alone. Some daycare centers sometimes have long hours and very the caregivers are minimal or little, spreading them too thin to give them adequate care. For the future, I was thinking of maybe they should have like 24 hours adult daycare, getting people aware of that there is services available for adult daycare, that they don't have to leave their loved ones at home alone. Then I'm going to talk about hospice care. This care is designed to give supportive care to people in their final phase of terminal illness, focusing more on comfort and quality of life rather than cure. The goal is to enable patients to comfortably be pain-free. The goal is, to control the pain. Programs are generally home-based, but they are sometimes provided services away from home. The advantages include comprehensive form of care from a group of or a team of professionals. Care is available 24 hours a day, including weekends and holidays. Usually results in reduction in your out-of-pocket expense. Some disadvantage, denial of diagnostic tests such as blood work or x-rays. Hospitalization is discouraged once patient enters hospice care. The future for hospice care, families need to be educated about hospice care because people don't get referred or they don't enter in hospice care until they're close to death, missing out what hospice offers. There's lack of awareness and for the services and benefits. For the future, both for nursing homes, I think better care, better individualized care, specifically for that patient. I think rate equalization is kind of affecting. If somebody wants to get extra service in a nursing home, they cannot do